Dr. David Jantz. Today I'm going to give you a demo on nutrition response testing and a little explanation of what we do at the clinic. A lot of patients have questions on how does this stuff work and what are you guys doing, so we periodically do a video to explain this. So first of all, I want to acknowledge the founder, Dr. Freddie Ullin. He developed nutrition response testing. We call it NRT for short. And over the years, I actually helped him teach in different states, so I have a lot of experience with this, and I want to share some of the information that we have. So I'm going to have one of my staff members come in, Katie. Come on over on this side, Katie.
Okay.
And then just go ahead and lie on your back for a sec. We can test the patient either lying down or standing. Now, we would have them stand up in certain instances. Like if I was testing her on her back and maybe she's got an adrenal problem or a heart issue, I would just have her come up and then I would have her face me.
Yeah.
Yep, and then just turn this way for me. And we use the arm. It's the most convenient because using a leg or the fingers is more difficult. So I just get a strong arm and then I run through the various reflex points, and we can check kidneys, we can check the heart, because obviously the heart is more strained when you're standing, and sometimes the thyroid is tested much more thoroughly when you're standing, especially the adrenals in the heart, because some people, their adrenal glands will test perfect lying on their back and they stand up and it'll actually show a problem. So just lie on your back. This is the traditional, typical way that we do it, is on the back. So what we're doing here is, you can just put your arm down for a sec. We're following a method. There's a pattern. There's 13 steps, and I'm not going to go over 13 steps. We're going to keep this simple so that it's understandable. But we're basically looking in the beginning, when we muscle test, for confusion in the nervous system. And what are we doing when we muscle test? We're working in the electrical field on acupuncture points, and we're working on organs, meaning we're putting pressure on different organs and stressing different organs. So I equate this to an electrocardiogram, an EKG. Like if you were to do an EKG on Katie, you would have the machine over here and you'd have leads that come over and then you put them on her chest. But those leads are obviously not on her heart muscle. It's the electrical flow of the heart that flows up to the skin, and those contacts, those electrodes will pick up that electrical flow of the heart, and then it reads out on the monitor on the EKG. So similarly, when I take the muscle and I make sure she locks, we can go over different organs and put pressure on those organs. And if that, let's say her spleen, which is around the corner here on the left side, if that spleen is infected, or if it's clogged up from a previous infection, or you're having trouble like with lupus or an autoimmune condition, you can just put a little bit of pressure on it and you're cutting the blood supply off, and it will cause a strong muscle that was previously strong to go weak when you're stressing that area. So you've got a field around your body and you're checking these points, and there's dermatomes that come up from the nerves, and the derma means the skin. So like on the spleen in this example, I can't push directly on her spleen, but there's nerve connections, or these dermatomes. Part of the nerve will go up into the spleen, to the skin around the spleen, and when you stress that area, it's enough to know that the spleen is stressed also, because the nerves connect through the spleen up to the skin, and then you put that pressure and the body will show that there's inflammation there by the muscle going weak. So in a like way, besides just compressing the organs, or the dermatomes are called, over the organs, you can just touch acupuncture points. Like there's an acupuncture point for the frontal brain, there's one for the back of the brain, there's one for dehydration on the tip of your nose. So you can just touch that acupuncture point, and they get electrical flow and they get overloaded. So just simply, if she's dehydrated and I touch that dehydration point, she will go weak. It's like an overload of electricity in the body. And it's not, she's not going to, just lock your arm for a second, she's just matching me. It's not a fight. Right, no. You know, a strong guy could obviously muscle you, but you just want someone to match your pressure. So match me, and she's matched me, and then when you touch a point, let's say she was dehydrated, she would start to go weak and kind of ratchet in the arm, and then it would drop down. So that allows you, you take that technology of the different organs, and then you apply specific nutrition to that organ. So if it was her thyroid right here, then we've got a whole row here for the thyroid, which is behind me, but we've got about a good 18 products here that we would actually take and put in her electrical field to see if it changed the muscle test. So we'll get into that a little bit more in a bit. So when you scan through, and I am going to just cover a couple things with a little bit of detail because people ask these questions over and over. The first three things we check is, can the person lock, which she does, and then the next thing you check is her regulation blocked? The ability of one part of your nervous system to go up when it's supposed to, called the sympathetic, and the other part of the nervous system to go down when it's supposed to, called the parasympathetic. And then at night, your parasympathetic helps you sleep. Your parasympathetic helps you digest your food. So these two nervous systems are parts of your nervous system called the autonomic nervous system. Parasympathetic and sympathetic work in harmony so that your body can, rev up when you need to, quiet down when you're supposed to. But they get out of balance when the body's not functioning like it should be. So when you take your hand, and there's a big net of nerves in your hand, and when you stretch it back and you put it over an orifice which has a like amount of nerves, the belly button, the mouth, the ears, when you put your hand over that, the body, if it's healthy and in balance, it will go weak. It's the one point on the body where you're supposed to go weak, because it's like two magnets. When they come together, the same pole, they go boop, and they go apart, and the body just goes, oh, that's not a danger, that's not anything that's harmful to the body, and it just relaxes if the nervous system is in sync. So here, we're actually doing it. She's not blocked. Now, just keep your arm there. If she stays there and the arm doesn't unlock, you know that it's called block regulation. And then you go through all these different stressors, which I'll explain in a minute, to figure out why is she blocked. Because if you don't do that, when you test the body, it's in a confused state. The second one you can do is switching. And that's where you put the thumb and pinky together. And it may sound silly and simple, but there's hundreds and hundreds of nerve circuits it takes just to do this. Only human beings and some primates can put their thumb and pinky together. So when you do that, if the body is in a confused state, it will go weak. This is where, here on out, everything that's bad is going weak. So if she goes weak, she's switched. Same thing, you have to run through these various stressors, which I'll explain in a moment, to figure out why she switched. And then you can do the other hand and figure out, make sure both are strong. Once someone can lock, they're not blocked, they're not switched, then you do the body scan. And the body scan entails, you can go to the front of the brain, you can go to the salt reflex, which is on the top of the head for electrolyte imbalance. You can go to the back crown of the head, and that's for blood sugar. You can go behind the head, which is the cerebellum, which would cause you to have instability, being a little off kilter, real poor memory you can have with that. And then you can go through and you can check the sinuses, you can check the eyes with light pressure, the lower sinuses, dehydration we mentioned at the beginning. You can check the jaw, because sometimes an old root canal or a broken tooth or periodontal problems can cause toxins and infection to go through different parts of the body. The mouth can be devastating on a case sometimes, like if you have periodontal issues or if you have an old root canal that's got a toxic bacteria leaching into the organs. These are more complicated things, but I'm just mentioning them as I buzz through. So you can check the tonsils, you can check the thyroid glands, super important. You can check the ears. A lot of young people get infections and congestion in those areas. You can check different parts of the lungs. Obviously the lungs are very important, the bronchial tubes. You can take the person's hand if it's a female, and you can do the top of the heart. You can stress the breasts on both sides. You can do the bottom of the heart. There's a circulation reflex here. You already talked about the spleen. The pancreas, that is one of the most beat up glands, and the reason why, it does two things. It helps you digest your food, but it also helps you balance your blood sugar. So lots of people have low blood sugar or high blood sugar, which is diabetes, and that pancreas will show right up real easily. And that runs at an angle, going down here. Then you can check the stomach, the liver on the side, the gallbladder, the small intestine. You can go through the colon. A lot of people have irritable bowel. You have digestive issues. You can take the hand and check the uterus, the ovaries. You can check the bladder. You can check the vaginal tract. And I want you to stand up again for me. And just face this way. Mm-hmm. Yep. And you can muscle test. I would be using, we're out of space here, but right. There we go. There. So the kidney, you can check the kidney and the adrenals, and you can check there's a bladder reflex back here. You can check the spine. There's skeletal reflexes that you can check. So there's a myriad of things that you can check on the body. So lie on your back again for me. Okay. Kidneys, by the way, can cause all sorts of problems with your electrolytes and a lot of people have chronic back pain, and it's their kidney that's congested, and that's coming from a chiropractor. It's actually the problem of the back pain when you flush the kidney out. Like, you can use these drainage remedies here. This is a typical one you'd use on the kidney, like Solidago, and you can drain the kidney out, and a lot of times their back pain clears right up. So as you run through these points, there's more points than what I mentioned, but this just to kind of generally cover things. So if we go through the organs and we figure out, okay, it's her thyroid that's weak. So we would take these stressors, and there's water in these vials, and they have a frequency in them. So it has the frequency of wheat, the frequency of corn, the frequency of soy, of nuts, of dairy, etc. Food allergies create huge inflammation on the body. And the buzzword, which is true, with disease, it's inflammation. What's inflaming your body? Is it stress? What kind of stress is it? Is it mental stress? And the physical stress, this is a huge one. Like, you can have, and I mentioned thyroid. If you have an intolerance of gluten and you have a rough thyroid case, you'll never get better unless you get off gluten completely, because it causes so much inflammation on the organ. Dairy, some people have trouble with oats, soy, and you'll get some oddball things every once in a while, like someone's really sensitive to caffeine, etc. And then there's the immune system that can show up. We don't treat viruses and bacteria and parasites and fungus. We don't actually treat that. We treat the body nutritionally to boost it up so that your body can get rid of these things. But sometimes kids, they have the dark rings under their eyes, and they have the ADHD, the ADD, they have parasites. And this can show up, and then you treat that nutritionally. A lot of people are walking around with fungus in their system, and they're just chronically fatigued, or viruses. I mean, obviously in this time everybody's worried about viruses because of the COVID, etc. But basically you're just boosting the immune system up so that it can take care of itself. And even one of the things I got added in here is GMOs, genetically modified organisms, in food that can actually cause inflammation for certain people. So you find out what kind of stressors they have, and there's heavy metals like mercury, aluminum, lead, arsenic. Those are the four most common, but as you can see, there's about 20 plus here that we get oddball ones that people have, that everybody's got a different story to tell about their toxicity. Some people, I have a lady that's got beryllium toxicity, which the first time I saw that in all the years I've done this, but that's a key to her case, because heavy metals get in the body, and if you don't get them out, then that tissue continues to suffer and be inflamed and never quite gets to where it's supposed to be. And chemicals and metals can take a longer time to get out of the system, but it's worth the money and worth the time and the effort to get them out, because it gets to the base and the root cause. That's what we're trying to do here. So there's chemicals also, like MSG, pesticides, formaldehyde. It goes on and on. Vinyl chlorides, chlorine and fluoride can mess with your thyroid. When we're talking about thyroid, so if people are getting fluoride treatments or drinking tap water and getting chlorine and fluoride, it will inhibit the thyroid. So you can't just, the point that I want to get across is you can't just say, here's your thyroid supplement and everything's going to be fine. It used to work that way, I was told, back in like the 60s and 70s, because more people back in the 40s, 50s, 60s, people were raised on farms and ate more whole food and they weren't exposed to so many chemicals and metals. So what you do is you find these stressors, and even sometimes vaccine residues will cause problems on people. Sometimes oddball things like mold, a piercing, say her tongue was pierced, better not be, right? or she had a piercing like a belly button. That can cause stress on the system, and if you don't take that out, the nutrition won't work. And another huge stressor is scars. That will sound familiar to our patients, but those of you that aren't patients, you're like, scars? That's one of the 5 main stressors is scars. So if you have a scar, it doesn't mean it's causing problems, but the bigger the scars are usually, and the thicker they are, the more problems they cause. So like a C-section that's been opened twice, and I'll just stick with the thyroid, but it can affect any organ. It's right on that midline, and it can throw off the thyroid tremendously. Or you could just have a scar down on your calf muscle that might be throwing off the left breast. You don't know the connection. It's not always just where the scar is that it causes the problems. It can cause it at a distant place. So we have to find those scars, and we'll have them touch the scar and connect it as we're muscle testing, in this instance, in my example, the thyroid. And you have to rub maybe wheat germ, which is a vitamin E based thing, in, or use a cold laser light on the scar. Because some people come in, some of these poor people, they've been burned, they've maybe had a mastectomy where you remove the breasts, and they've got a lot of scar tissue that if you don't handle that, the nutrition will start to work, and then you'll go back into that situation that I explained at the beginning of the video where you're blocked or switched. Nervous system keeps going back into confusion because of the scars. So you have those 5 stressors, and that could come up that I found maybe chlorine on her. This is in the thyroid example, and I'd have to detox that. And you would match something that pulls out chemicals and metals. In this instance, probably be parotid, a product called parotid, to pull out chlorine. And let's say that she's got a dairy allergy. She might need a digestive enzyme to break down her foods better, and obviously you would avoid the dairy. So what you do is you put this together, and then you test different points to make sure what other organs you're picking up, and it's like peeling an onion. So let's say Katie's a new patient, and she's got fatigue, she's got a lot of stress, she's not sleeping. Let's say she's overweight, which she isn't, but let's say she's overweight. She's got all these other issues. She might show up thyroid and something else, and then as the thyroid starts to get better, then you might find that, oh, we've got the adrenal gland showing up, now we have the kidney showing up, and maybe the ovary. So it's like peeling an onion down. But the difference with this and the awesomeness, I just made that word up, Glenn. the awesomeness of it is that I would say 99% of the people that you talk to, they understand that nutrition would work. They can think with that. Like, it makes sense to most people. Like, drugs aren't really what you want to be using. Obviously, in certain instances, we need medication. But for chronic conditions, drugs don't solve that, and they also have a lot of side effects. So not only you're not solving the root cause of the problem, you're creating other problems in the body. So it's real important to try to get to the root cause, and that's what we're trying to do with this. So if she's got a dairy allergy and she's got chlorine toxicity, we're going to use common sense. We're going to tell her not to drink tap water in this instance, not to take long hot showers and breathe in chlorine in this instance, and to avoid dairy, and then support the thyroid, detox these things out, go into the next layer, and then you peel it off. Because nutrition, what my original point was, is most people understand nutrition works, but a lot of people, you don't know what to take, because you hear your neighbor, I took this and I felt fantastic, or I take this supplement from this company, I felt fantastic. But it doesn't necessarily, they might go and go, that didn't do anything, or maybe feel worse, because every single person is different on what they need. You are very individual, you have your own story of what's happened to your body. So the beauty of this is you can walk into the body and check it efficiently and quickly without having to draw blood, which costs, it would cost like a couple $100 at least every visit to analyze the patient, if you could analyze it by blood. So this allows you to check the organs, and you can monitor the organs and then take the person through the layers. And a comment on blood work, I dabbled in that, I like it. Sometimes it's like, wow, that was awesome. The blood work detailed this one thing that was deficient on the body, and we can fill that void, the patient felt better. Other times the person's really sick and they come in here and go, I had all my blood work, I've had it done twice, and they say there's nothing wrong with me. So what I'm getting at is that you may have, when originally I talked about the spleen as an example, if she had something going on in her spleen, it wouldn't necessarily show up on her blood work. Or even the thyroid. People walk in all the time and they've said, I've got thyroid symptoms, my hair is falling out, I'm tired, I can't lose weight, and my thyroid's testing normal. Or the heart. The heart might show up normal blood pressure, the MDs are happy, but there's actually a weak heart or a sluggish heart. And something I'll just throw out a couple interesting tidbits, like on the heart with a young person, that's often the cause of chronic ear infections, is the heart. And some of your most constipated cases come from a slow, sluggish heart. And it's not a dangerous thing, but it's weak. And this will be on kids especially, but even adults too, where the heart's just not strong enough to push the bowels and empty the bowels. So we're working on all these various things and just putting things together so that the body can actually get well, versus just guessing and like, okay, you have these symptoms, or just listening to a friend or a neighbor or going by symptoms. You don't know when to stop the stuff, you don't know which product's going to test the best. So let's say I had, we were working on her liver, and there's a product called Liviplex from Standard Process that clears the liver. You might find that works fantastic for maybe a couple months, and all of a sudden you need to do something else on the liver to keep it moving forward so that it can clean out and clear. So it allows you to interpret what's happening with the body on a regular basis without taking x-rays and costing hundreds of dollars. So one of the things with the body is, some people will say, well, I don't know if I believe you have an electrical field around the body, because you're working within the electrical field. And I just want to let you know that a scientist named Carolean's been photographing, or did photograph, the electrical field back in 1949. And you can actually, we have some pictures here where you have the field of the body and how it shows up. So you're in that field working acupuncture points, but you're also on the organs sometimes and compressing them and cutting the blood supply. When I say compressing, like if this were her heart, I'm only just pushing in with very light force there. And by the way, since I'm on this spot, there's a blood pressure reflex here too in the bicep. There's a reflex for fluid retention. It allows you to get around the system quite well once you learn it. And it's an art besides the technology. This is a technology that we have, and I think it's a very precise technology, but it's also an art. So you have to be able to think with it. You have to be experienced, or get yourself experienced and knowledgeable, because you have to put the things together. You could find the perfect issue on Katie in this example, and if you gave them the wrong product, you may not get the best results, or you'll get half the results that you could by knowing your products and making things a little bit faster and more efficient in the body. So, I'm Dr. Jantz, and I really appreciate your time, and thank you for watching this video.